Okay. Action.
So, welcome everybody. We are now officially recording this as well because Mark's got the capability, and apparently then I don't have to do this more than once. So, because this is my first time doing this training, don't have your hopes really high, but the whole purpose of this quick Zoom meeting getting together today is so that we can go over what is called basically the worksite specific plan for preventing COVID for Hillcrest Center, but it's applicable to any and all office space within the district. Matt has shared with some of you the outline that we will be using to do a plan for virtually every single one of CRPD's facilities and amenities, so that work is underway. One of the things all of the plans will require is identifying the person responsible for the plan and basically the training and some other things that will be required. And then there is, let's see, what's the best way to show that? There's a...
it's not going to show with your background.
Won't show with my background? Anyway, there's a handy-dandy checklist that disappears because I have a background. I don't know if we can hold that up to it. Oh, it won't do the camera. No, because it's doing my thing. Let me get rid of my camera. Let's see.
Tim, do you want to...
None. Here we go. Here, I just did none. Took away. So, there we go. So there's a checklist that this came from the County of Ventura, and virtually every facility in place will have to create a checklist along with this email that you got, the worksite specific plan that has a cover sheet, and then, you know, the text that goes with each of the plans. So hopefully you have that in front of you. So I'm just literally going to go through this sheet of paper that I know you could all read, but Mark is here to actually click on the links as we go through it. In order to, again, do this plan, we had to pick somebody who's primarily responsible for it. So I chose myself for Hillcrest Center, but it's very clear that it is only for the office portion of Hillcrest Center and not for, like, Hillcrest Center for the Arts. So Scott, or most likely, will be responsible for working on and coming up with more of the community center type plans for preventing COVID, but obviously we're all working on this together, so there'll be help and that kind of thing. In addition, the plans will have to have a coronavirus hotline. That's kind of like an opportunity for either ourselves or for the general public to call and say, hey, we don't think they're doing something properly to help prevent the spread of COVID, and we have had people call that line on us, and specifically related to some of our rec amenities. So we actually have had, I understand somebody from public health went out into Wildwood and even looked at some of the stuff going on at the trail. So that can happen and probably will happen as we start opening things up. The plans will require everybody who's doing their own to do a risk assessment, which just means think about how COVID may be spread in the area that you're working in and consider those risk areas and if there's any options or ideas on how to maybe mitigate those. So here we're getting closer into the employee information and training part. Everybody should mess around on the internet and at least click on a few pages on the CDC site, the state's COVID page, and the Ventura County page, just for your own, hopefully, curiosity and education about it. A lot of this, all of this is very new to everybody here, so we're all kind of learning as we go, and I think any and all of us need to be informed and aware of kind of, the baseline of what's kind of going on with COVID, to specifically know what's going on in Ventura. Just that VC emergency page is great. I don't know if you want to click on that. Hopefully you guys have all looked at this multiple times, but scroll down. It's got all the details, including how many cases within each city and all that kind of stuff. And then if you go even further down, it's got little graphs and charts that are loading, apparently, 4 pages of those. I don't know why they're still loading. Go up, yeah, right there.
Oh,
So that when that loads, it'll have some pretty cool graphs and charts on. Yeah, so there's 4 pages of, detailed information about exactly what's happening when in Ventura. So that's really not something we need to get into in the weeds, but if you're curious, there's your data for Ventura County. So getting into the training topics in terms of, number 1, the general health information about COVID-19. Obviously, we all know that it is a coronavirus that is spread in both by air and apparently surface. Information is constantly changing and being updated by people studying it. It is most deadly to people with underlying health conditions, so it's people that should be really considering extra precautions are if you're over 65, if you have an underlying health condition like autoimmune disease or heart disease, I think it's lung disease, and diabetes, I think, are the biggies. So I do not know people's medical condition. Hopefully, you are thinking about that if you do have any of those underlying conditions. My dad, who died 3 years ago of virtually all those and more, would not have done well in the COVID world. He was full of underlying conditions. Here's a biggie, okay? So we went to the safety committee with this. The administrators talked about it. We went to the safety committee, and we had to come up with a process for doing individual health checks for people starting to come into Hillcrest Center, the employees. And we are electing to go with what are called a self-administered health check. So I know some places are going to, stop you at the door and take your temperature or ask you a series of questions. And we don't really feel like that's necessary for us. We are going to do what's called this, and this is an option we can do under the prevention plan guidance, is a self-administer check. So you will be, go to this page, yeah, or go to the page, the link.
Next page.
Next page?
Next page, right there.
Yeah, and actually the same link is up above too.
You want?
You go that one, but the same link is up above in the other section. I'm looking at that section, but you can do this self-administered health check, and it is basically, if you click on the link, that's great. It's right on the CDC. Cough, shortness of breath, fever, chills, muscle pain, sore throat, loss of taste or smell. So those are the common symptoms, but there's even uncommon symptom like typical flu and diarrhea, nausea, vomiting, diarrhea, that kind of thing. Basically, if you're sick, think maybe I have COVID, stay home, call a doctor is kind of the plan. The days of, yeah, I'm not sure I feel so great, but I'm going to go into work anyway, that's over with. Don't be a hero. If you're not feeling great and you have any of those kind of symptoms, please stay home and let us know and maybe call your doctor. So if you are sick, what are you going to do? And there is another link. So we go back out of here, back to page 2, I think. Scroll up. Yeah, so right there. What do you do if you are sick? There's a CDC page on that. And it's basically, I'm just reading it like you, stay home, call the doctor, take care of yourself, drink lots of fluid, don't get on a bus, separate yourself from other people, monitor your symptoms. So basically everybody here, please kind of take a gander through that. And hopefully you'll remember, basically, if you do wake up sick one day, you're like, what should I do? Feel free to call your supervisor, call Shelley, call me, or look on the website, but there's lots of things to do to make sure you're not spreading coronavirus. Okay, I think that's good from the CDC. So now we're going on to the importance of frequent hand washing. Now, this is where you almost feel silly having to talk about some of this stuff with you guys, but it's part of the training. So the CDC has guidance on hand washing, on hand sanitizer, that kind of thing. It's important that it be at least 60% alcohol, so the last thing you want to do is think you have some great product that actually isn't killing the virus, so you got to make sure it's got at least 60% alcohol. So there's even guidance on the CDC from exactly like how to wash your hands, and I'm not going to get into that with you. I'm going to trust that you guys figure that out. And then number 5, the importance of physical distancing. We all have, I think, become very aware of that if we've gone out at all. 6 feet at least if you can, and if you can't, one of the solutions in a pinch is to try to put on a face covering. So if you're unable to get within, keep that 6-foot separation, but you need to pass somebody in a hallway, or you're just going to be sitting staring across a table from someone and speaking, we'd want you to wear the mask. So the face covering, and again, it's just a piece of cloth. It doesn't have to be that N95 special face covering. And then the final item under the training is we want everyone to be aware of the fact that they do have various leave benefits available. Obviously, we have our normal sick leave for people sick, so don't try to, again, be a hero, come in and save your sick bank because you're, not feeling that bad, The plan now is just don't come in at all if you're sick. And now there are special, because of the CARES Act and that prior one that I forget the name of. The
Families First Coronavirus Response Act.
Families First Coronavirus Response Act. We do have even additional types of leaves that may be available, especially if you are a parent or actually have the disease or are caring for someone with the disease. So Shelley is going to answer the phone if you call and try to help you through that if, in fact, you do get that. And then just really, to be really clear, if, in fact, somebody does get the coronavirus and you have been at work in the building in the past 14 days, there will now be a presumption that the way you caught it was through work or it was work-related. It's a rebuttable presumption, so it's like, okay, you probably caught it at work, but if they do contact tracing and find out it was your giant quinceañera that you went to and everybody in your extended family all have it because of that, then it probably wouldn't be a work-related workers' comp situation, but just be aware of that. We're going on to the next section, the individual control measures. Again, we just talked about the individual health checks. I don't really need to go through that again. And again, any questions, it's really Shelley or your supervisor should be able to chat with you about if you do get sick, what to do next. And I'm guessing most supervisors will say, talk to Shelley. So Shelley's going to be the main point of contact for people that actually, do get sick. Personal protective equipment and measures, that section, again, it's mostly everything we have been doing already. Cloth face coverings in Ventura County are not required. They are required in LA City and parts, and I think the county. It's a little confusing because we're right on the border, so some places you'll see people wearing them outside no matter what, other places not so much. So it's a little bit all over the map on that. What we want to do specifically inside Hillcrest Center is to not have to wear them when you're at your desk, when you're working in your office, even, a cubicle, you don't have to wear your mask. And once you are in a room with others, like I should actually probably be wearing mine now because I'm in a room with, 5 other people here. But I think you need to see my mouth for purposes of this conversation. But we ask people to wear a cloth face covering when you end up in a room with others or are walking the hallways kind of thing. And then avoid touching common surfaces as much as possible. And then the wipe down procedures are going to be primarily, we're saying, protect yourself, meaning when you get in a room, you probably should wipe down your area before you start to use the tabletops and the kitchen countertops, that sort of thing. But courtesy dictates, leave it cleaner than you found it. So it doesn't hurt to wipe it down when you leave as well. And we have the disinfecting, oh, you can't see that. I'm going to show you. We have the can you see that?
Oh, no.
We have the disinfecting products there on the table now. So we have, you know, your squirt bottle of disinfectant, some hand sanitizer, and then these great signs that Jody's making and stuff to wipe them down. And we're going to just leave these on the common area tables in the kitchens, you know, at the front desk. So there's these, you know, this ability to quickly wipe things down. It shouldn't be too inconvenient. And if we all do that, hopefully we'll be all taking care of each other. So that's that. Oh, and gloves. We haven't been wearing gloves in Hillcrest. Many of us have been coming. We probably had at least 10 people in here a day, something like that, as we've gone through the first 8 weeks. And so we haven't been doing gloves. We don't think gloves are necessary. However, we will have one of those tissue box size things of disposable, you know, latex type gloves that if you want to use them, they'll be available. And then Matt, I don't have it in my pocket.
I have one,
I have it.
but do you have yours?
Yeah, I didn't put it on my keychain. I'm going to show you another show and tell item. Now we're sharing something. Squirt it all.
Wash your hands when you're done, don't
I will wash my hands when we're done. Matt got these cool tools, right? So this little thing is a poker, so I can I can operate the copier. I can poke someone on the shoulder. No, and then it's also like a hook. So if you need to open a door, you can do that. So Matt ordered enough for everyone to have one of these, and so it's another way to minimize touching and contacting others. We are trying to keep as many of the doors propped open as we possibly can so that we don't have to worry about opening and closing doors and touching the same surfaces, but obviously some doors have to be closed and open, so we've got that. So, and then cleaning and disinfecting protocols, I already did the show and tell of all the nice stuff that is on the common area tables. In your own personal area, we are going to just leave it to the normal janitorial. The folks come and empty trash cans, but for the most part, there's not a whole lot of other stuff happening. We will be responsible for our own individual spaces, so your own desktop, your own computer, your own phone. You are responsible for yourself. Don't use other people's stuff. Use your own stuff and keep your own area clean. And in terms of products, you want to make sure you're using the right EPA product. Easiest thing is to grab something out of the common room, clean up your area and bring it back. But if you have a special smell or some product you like, just make sure it's one of those EPA approved ones. I think that the last link is the link to the approved products. So yeah, there's just this giant list. So if you scroll down, you'll see there's like this giant, you know, yeah, that thing. So under the virus thing, you can actually go, there's like a way to search by coronavirus, and it'll say like every product that works against the coronavirus.
You can also, the product should have an EPA registration number on it, and you can put that in and do a search.
Yeah, so that EPA
registration. Which is what I did with this stuff here.
Oh, perfect.
Updated today. Cool.
Yeah, so there's a yeah, if you're at all curious, there is a link, and you got it there. So for your home as well, you know, use that link, because I think go all the way down and then go to page 17. If you click on, at the last page. So there, see the human coronavirus under the table. So that's just got page after page after page of what works on the human coronavirus. So if you're at all interested in getting into the weeds on it, I'm just going to let Matt buy stuff or Jody buy stuff and use whatever they do. And then finally, the elevator. We actually do have an elevator. We do want only one employee in the elevator at a time. I personally can go months and months without being in the elevator, but I know others might use it more frequently. So we haven't really come up with a plan for who is going to wipe down the elevator buttons once a day or something, but we'll figure that out. Other than that, you can use that poker tool and not have to touch the elevator button, right? So that's why we want that poker tool. And again, that the teleworking, telecommuting agreements remain in place, and they will remain an encouraged way to perform our work. Some people sort of have to be in the building to do their work. Some people can do almost everything from not at work. And I think most everybody, there's some balance between the two. There's some time you're in the building, some time you're not. We want people available, though, if they are working from home, to be available and to try to, I know it gets hard to, be normal, like 9 to 5, even if you're home, but you just should be working closely with your supervisors or your employees to make sure that, there's some fairness and accountability to the work at home kind of situation, and I think we'll be fine. With that, I am done with the formal training that is part of the actual required training for the worksite specific plan. We have already submitted it to the county. We self-certified, so we are one of those businesses that self-certified. We can now be inspected by the city. They're actually going to dedicate code compliance officers to help inspect for the county the businesses, whether they have their COVID prevention plans in place and that kind of thing. So we now have our plan in place. We have to make multiple copies and put them in common areas so they're available, which we will do, but you also have them on the intranet. With that, we are available for questions. Everyone having fun? Not a single question.
The presentation was so good.
It was that thorough. Okay.
Hey Jim, I'll ask something.
Oh, thank you.
Yeah, it's I thought I read it could have been a bad link, but I was curious because I heard that the CDC was saying surfaces aren't as bad as they thought.
Yeah, Lean just told me that today, that she saw some breaking news that they're thinking it's more of an aerial respiratory spreader than a surface touch spreader. I don't know if that's good or bad, but yeah, I think that just kind of came out too.
Good.
Yeah, I think this just goes to show how this is a dynamic environment. Just like the list of symptoms, as they learn about it, they could add, things and different symptoms. Which is why I think the links are all important to continue to monitor, because as things are updated, things are changing. And this plan is as of today. We are still closed to the public. This will change. This will, as things change and as we open and as we have more people in the building. So there will be updates.
I have a question. I mean, will there be an announcement when you think we can all be back at Hillcrest together again on a regular basis? Is that up to the CDC? I mean, what are our guidelines in terms of the people in this building and how many we can have?
I don't think that I don't think that there will be a requirement that tells us we are now required to be at work. It'll be more of you're authorized to sort of load up. So right now, it's almost a preference that there still be telecommuting. That's kind of how it's built into the current instructions. It's like, hey, you can start opening up, but kind of go slow, and if people can still sort of telecommute, why don't you keep doing that? But when people do come back in the buildings, make sure you do these things. Here's the protocols. This was built as a generic office space plan template, and it's actually for a lot of businesses that were completely closed, where they weren't even open, right? So there's places where people were walking back in a building for the first time in 8 weeks or something. We've been open the whole time, so for us, it's not as new. Yeah, Scott.
Yeah, can we get John to attach a battery-powered UVC light to the big drone and fly it around at night to just disinfect everything?
Why at night? John would be doing that all day long if we let him.
Well,
Yeah,
because
we
you
just need
really
a big
don't,
battery.
you don't want to be shining that on you. It's dangerous.
Oh, okay. No, wait, I won't say it.
So we have a
Um,
question in here.
Okay?
Can you hear me? Okay,
Yes.
so we kind of went over this with at our last meeting at 2. And one of the questions came up was if someone is identified as either having it or has been around someone with it, do we have a protocol of what we're going to do when someone tells us, oh, I got it, or my mom has it, and I was with her this weekend?
That is a fantastic question that Shelley has been thinking very hard on. So I'm gonna let Shelley respond.
So number one, and it is written here, anybody who reports symptoms or is concerned or is obviously positive or has their own close contact who has tested positive should notify you and, call me right away. We are going to obviously follow the guidance. Liebert Caspi has provided some guidance, that's kind of like a step-by-step, if this, then what, which we'll follow. And we're going to want to get together and notify, identify any contacts, close contacts, so that we can notify, employees who may be affected, who may need to isolate. So those are the kinds of things that we need to, follow up with and work together on.
And
Shelley?
again, sorry, go ahead.
It's okay. So do you know, is it, if I say I was around someone with it, what's our rule? How long do I have to self-isolate? Is it 14 days or?
Part of that is going to be by what the public health, so, we're going to be going by the doctor's guidance as well. So it depends on what it is. If somebody is positive, then it could be 14 days. It could be longer if they still have symptoms. If somebody is positive, we're going to require a doctor's note for them to come back.
Okay. The other question, part B of that question was, so we have a lot of part-time staff that hopefully will be coming back to work, and they may have already exhausted all their sick time, California sick or whatever. So, I know if they have it, they would get the 2 weeks up until December or something like that, I believe. But if they don't have it but allegedly have come into contact with it, or if they just are not feeling good, but are we going to compensate or do some kind of additional sick, or, because we're encouraging them not to come home or come to work?
The Families First leave is available to anybody through the end of the year, so that will be available even to new hires. So if we brought somebody on, that they're eligible for that right away.
And they have to have it, right?
No, there are, I think, 5 qualifying reasons, so you don't have to have it. It could be that you've been advised by a provider. There are different qualifying reasons for which you may use it.
That's right, I forgot there were the 5 reasons, and then that gets a certain percentage of dollars, potentially.
If it's for their own, situation, it's 100% up to $200 a day. If it's for family, for childcare, then it's 2/3 of their pay.
Okay.
Scott?
I was going to say, because my wife's at risk, I went ahead and got negative tests on both things. But if you have decent insurance, a PPO, at least the Anthem ones, it was 100% covered at Westlake Urgent Care. So if you're at all interested in doing it, apparently getting more tests might get us open more. Insurance might cover it. It did for me. And it came back in one day.
All of the PERS insurance plans should be covering it at no charge right now. They've actually announced that for all of the plans, HMOs and PPOs. And as far as I know, even some of the county public
That's what I
testing
was gonna say, yeah.
is,
It's free.
it is free. There's no charge.
But you're not allowed to go up there and get tested.
No, the county changed, so the the free county, locations are now, there was a kind of you had to have a reason to go there. Now it's open to generally anyone who's curious, so you just have to register, online.
So you don't have to have symptoms to get tested?
No.
I think the wording I saw today was if you have any reason to suspect, then you call.
Right. So yeah, you can do it through your own medical thing, or just go to the county one. I think the county one, though, still requires an appointment online, so.
We're college, right?
Right.
That's what I heard.
They're all over the county
Yeah,
now. There's like
And-
8 of them or
Yeah.
something.
And for Westlake Urgent Care, you just went online, made an appointment, and popped in. It was a piece of cake, and you know, my brain needed to be tickled, so it didn't hurt that bad.
We went to Exeter and Camarillo, and there was no wait. Nobody was in there. It was
Where was that?
Exeter and Camarillo next to Trader Joe's.
Extra urgent care.
Oh,
Yeah.
okay, all right.
Yeah, in Thousand Oaks, if you're in TO, there's one at the Newbury Park Library, the county one.
Let's take a field trip.
Yeah. Yeah, so, right, if you're at all wondering, I guess they are available. I personally haven't done one because I don't feel like I've been sick, but I know that you don't even have to display any symptoms and you can be a carrier, so.
We did the antibody one because I thought that Joe was sick in December and January, but no antibody.
Did you have it or no?
No.
And I did both of them. I had a wicked flu at the beginning of March, and so both of mine came negative, although they said the antibody test is 50% false positive.
Right.
Oh, yeah.
Oh, interesting.
HIPAA schmippa. We share. All right. So seriously, guys, any questions, ask me, ask Shelley. We're excited to start reopening things. The status remains, unchanged from a week ago in terms of our what's open, what's closed, our red and green differential facilities. Just in case folks are curious or wondering, there is growing interest among some of our board members to start to reopen some of the things that are currently closed. So like there'll probably be a discussion about basketball courts next, or the bike jump park, or maybe even the skate park. What's nice and clear is that community centers, pools, playgrounds, and picnic areas are all very specifically listed as not to be opened. But the things that aren't specifically listed, there's some growing interest in trying to reopen things that the public may use properly or may not. I guess the other items would be the public restrooms, and then just in case you've heard, virtually everybody's canceled the 4th of July fireworks show all around us. We have yet to do that, so we're still kind of holding out hope, waiting to see what the next public health order is before we give up. But we'll see. Thumbs up. Well, thank you guys. I really appreciate everybody. I'm not aware of, and I wouldn't necessarily know every single person's health condition, but I'm not aware of anyone within the district having had it. And I really hope we can have these prevention plans in place and try to keep it that way. But obviously, if the unfortunate thing does happen and somebody or some group of us get it, we do have those protections for us and extra balances. So we shall get through this. And I think whenever I think, gosh, this is so hard and confusing, I especially feel for rec and what they're trying to go through to open things up. I think, oh my gosh, can you imagine if we were a school or a university trying to figure this out? So it might be tough for us, but there's other people dealing with it as well. So thanks, everybody.
Bye, guys.
Thank you.
Bye. Thanks.
Give me a shot of that.